Here is my group of 8 individuals. And now we're going to get started. The U.S. should adopt the Family and Medical Insurance Leave Act. 25% of women in the U.S. go back to work just 2 weeks after giving birth, according to Mary Beth Ferrante of Forbes in 2019. The United States is the only industrialized nation without a formalized policy guaranteeing workers paid time off when they become new parents, according to a study by Adam Bertle in 2016. This same study was a result of 2 decades worth of research. He found that paid parental leave contributes to fewer low birth weight babies, fewer infant deaths, higher rates of breastfeeding, longer parental lifespan, improved parental mental health, and increased long-term achievement for children. During my MP Masters of Public Health program, I did a project about gender equity in healthcare. After our research, we learned that paid parental leave was one of the most significant policies that actively reduces gender equity. My proposal is that the United States Congress should pass the Family and Medical Insurance Leave Act. The Family Act will benefit all. Children will live longer, healthier lives, mothers and fathers will share the burden of parenting more equitably, and businesses will benefit from mothers returning to work. What is the scope of the problem? According to Mary Beth Ferrante of Forbes in 2019, the postpartum period can be full of challenges, including depression, lactation issues including mastitis, fatigue, general pain, and illness. However, only 14% of workers have access to any amount of paid parental leave. The following statistics are provided by Kelly Wallace from CNN in 2015 and Mary Beth Ferrante of Forbes in 2019. So what are the benefits of paid leave? Families with paid leave not only provide favorable nutrition to their children, but also bond with them. This creates healthier babies, which means fewer sick kids and requests to take time off to care for them in the future. According to a 2011 study of 141 countries with paid leave policies, paid leave can reduce infant mortality by as much as 10%. We also see an increase in well baby care visits and vaccinations, and an increase in the rate and duration of breastfeeding. Women who had paid leave breastfed twice as long as women who did not. We saw a reduction in severe depression and an improvement in overall mental health. According to Claire Miller of the New York Times in 2015, the current Family and Medical Leave Act gives workers 12 weeks of unpaid leave, but only about 50% of U.S. employees are eligible. So what are the benefits of the new Family Act? It will strengthen families' economic independence, promote parents' workforce participation and equity, improve health outcomes for children, and provide for a stronger national economy. This act needs to be passed through Congress to benefit all families. What will the new Family Act do? It will provide workers with up to 12 weeks of partial income. It will enable workers to earn 66% of their monthly wages up to a capped amount. This will ensure that low and middle wage workers have a higher share of their wages replaced. It will cover workers in all companies, no matter their size, and the funding will be 2 cents of $10, or 0.2%, which is less than $2 a week for a typical worker. Has this kind of policy worked elsewhere? Yes. A study of California companies that have adopted paid leave found that 87% reported it had not increased costs, and 90% reported no negative effect on productivity, profit, and morale. When Norway converted from unpaid leave to paid leave in 1977, A range of benefits in child achievement could be observed. Most importantly, the benefit to children of disadvantaged mothers was roughly doubled. This implies that paid parental leave may not only improve child health, but also reduce inequities in health and achievement. How will we pay for it? Through payroll contributions of only $2 a week. Will it only benefit moms and babies? No. The Family Act will make it easier for fathers to play an active role in their child's early months, and it will have a positive effect on the economy. A review of my proposal. The U.S. Congress should pass the Family and Medical Insurance Leave Act. So what can you do to make this happen? Go online now at www.nationalpartnership.org and share some of these statistics. Tell your representative to urge Congress to co-sponsor the Family Act. Paid parental leave benefits children, parents, and the economy. The hard work is done and the policy is in place. All that's left is convincing Congress to pass the bill. Call your representatives today to support all families in the U.S. and ensure that all children grow to be healthy, productive individuals.